views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to BronxTalk, a very difficult time for everybody, but there is hope. And one of the hopes that are out there is getting a vaccine. Wouldn't it be nice if everybody could get vaccinated? However, there are issues, and I'll call out some of the numbers. According to a Pew study, only 32% of Black Americans are likely to take a coronavirus vaccine, 50% of the white population, and in fact, 75% of the Asian population. So there are a lot of people still saying to themselves, I don't know if I want to do this. Well, it's an issue, and it's something that we're going to address this evening. In addition, which I have learned through this process of preparing for the program, one of the issues is, frankly, a valid concern, and that is who is participating in the studies, in the clinical data that's derived from the studies to determine if it's safe or not. And we're finding out that only 14% of the clinical studies were done with people of color. And that's really our subject today. What's the status of the vaccine? Who should be taking it? And I'm pretty sure our guests this evening are going to encourage everybody to take it. So first, let's welcome the Chief Medical Officer from Acacia Network. Welcome back, Dr. David Collymore. Nice to have you with us, sir.
Thank you. It's a pleasure to be here.
And the attending physician of infectious diseases at Montefiore Medical Center is Dr. Julian Torres. Dr. Torres, nice to have you with us.
Thank you, Gary, and thank you for inviting me to your program.
The president and CEO of Associated Medical Schools of New York. Welcome back to BronxTalk, Joe Wiederhorn. Nice to have you with us, Ms. Wiederhorn.
Well, thank you. Nice to be here.
And we're going to talk with you in a few moments about the whole notion of disparities in healthcare that leads to this whole concern that many people do have about taking the vaccine. So, Dr. Collymore, let's describe the universe. Where are we at? What's going on with the vaccine? I know Acacia does a wonderful job at providing all kinds of services. What are people telling you? Are they taking the vaccine? Where are we at?
I think I will echo a lot of what you have already mentioned. Acacia, we began implementation and administration of the vaccine on the 22nd of December. So we've administered successfully to a little over 500 people at this point and looking to pick up the pace in the weeks to come. So we were intentional about making sure that the communities that we serve, primarily communities of color, had access to vaccine supply. And we're embarking on a number of public education campaigns, both with our staff as well as the communities that we serve, to make sure that questions are answered, that folks that have questions or concerns regarding the vaccine have access to the medical professionals that can answer those questions.
Are people coming to you and saying, or have you heard of people in the community who are like, I'm not sticking that in my arm. I'm not taking a chance. I don't want to do that.
Yeah, I think, I was actually talking to somebody earlier today. We did an initial survey of all of our staff on day number one. So on the 20th, 21st of December, we surveyed all of our staff and got a little over 400 responses. And I think the responses were divided in thirds. So there were a third that said, yes, I'm ready to take it now. There were a third that said, maybe, but I have some questions that I'd like to have answered. And there were a third that said no. So I think that's representative of many of the communities that we serve and also of the healthcare providers that we see nationwide.
Do you see those lines drawn between those thirds largely or partially defined by ethnicity?
Our workforce is very much reflective of the communities that we serve. So I think what we see is a reflection of what I would consider to be a good representation of the minority population of an African American and Latino base of individuals.
What is your medical advice to those people who say, I'm hesitant or I don't want to do it?
You know, there's good reason for hesitancy in communities of color, given the historical treatment and mistreatment of people of color by the American medical system. We cannot deny that. I think to disregard that, we would never get folks to consider the benefits of the vaccine. But once we acknowledge what history has shown us and demonstrated to us, then we have to talk about where we've been over the course of the last year and talk about how the pandemic has devastated our communities and how the number of deaths has been disproportionately affecting Black and Latino communities nationwide. And once we think about, particularly here in New York, where we were back in April and May of last year, I can only describe those times as horrific times. So when we think about that and we think about how numbers across the nation now are surging at rates that we have not seen at any point in the pandemic, then we have to say, well, what are the tools that we can use to combat this? And then we look at the opportunity of having a vaccine that has been proven to be highly effective in inhibiting hospitalizations and decreasing the rates of hospitalization, serious infection, and ultimately death. And that is our goal. Our goal is to get back to a point where our hospitals are not overwhelmed by COVID positive patients, that we're not counting thousands of individuals dying each day in this country. That's the goal, and that's the purpose of the vaccine. And because of that, because it gives us the best opportunity for success, that is why we need to take the vaccine.
And you're recommending that they do. I have to tell you that I really appreciate your honesty, because many in the medical profession say, just take it. There's no reason not to. But the fact is that you acknowledge that you understand, given the history, given the way people of color have been treated by medical institutions, that you understand it. But as we follow through your reasoning, you know what? This is proven to be safe. We acknowledge that, but let's get everybody to take it. I mean, am I interpreting what you said correctly there?
Absolutely, absolutely. And I think that has to be sort of the conversation that's had. Particularly with people that are hesitant. It needs to be a dialogue, it needs to be a conversation, there need to be multiple educational sessions. So I appreciate the opportunity to even be on with you now, because I know this will be information for many folks and will help to convince folks that are skeptical that the vaccine really is going to be life-saving and is going to be world-changing. Once the majority of the population is vaccinated, we will be in a position to hopefully one day look back on the pandemic as a piece of history.
Unfortunately, we did lose, in New York, tens of thousands, and of course,
right,
across the country. Let's bring in Dr. Julian Torres, who's in infectious diseases at Montefiore Medical Center. Let's go back in history a little bit. So these clinical trials, which I frankly learned through my preparation for this program, it's like the prejudice starts even there, because, and then that kind of justifies somebody saying, well, wait a minute, you didn't test my people. Maybe we have some genetic issues that might need to be addressed, but they didn't do that when they did the trials. Talk to me about the process of the trials and who was in and who was not in.
Yeah, so absolutely. I mean, clinical trials, they go through different phases, as some people know. So it's, phase 1, 2, and 3. Basically, in the initial phases, you have small numbers of people. You're checking efficacy and you're checking adverse reactions. And, traditionally, these clinical trials, as you mentioned at the beginning of the program, have included a lot of people that are not representative of the, the whole U.S. and world population. For different factors, lack of access of these communities to academic centers, right? Mistrust, fear, right? And, one of the important things that we are trying to do with these vaccines and other trials in other areas of medicine is to include people from diverse backgrounds, because, first of all, people that got sick, as you mentioned before, there was a disproportionately affected especially in New York and the Bronx. So mortality rates were higher in Latinos and Black communities, right? And we are not having these patients included in our vaccine trials. So people want to know, how these vaccines work in these communities, right? So I think that's very important. because there's not only genetic differences, different responses to the vaccine, but also because people affected need to be included in the trials. Absolutely.
I think if more people, let's say if you knew that your neighbor was part of it, who said, I'm going to be part of a clinical trial, you'd say, oh, wow. And then when you saw the results of, what they came out with and say, well, we believe it's safe, you'd say, oh, my neighbor did that. But if you don't have that kind of human contact, then it's like some other bureaucracy is telling you what to put into your body. That becomes a very, very, very personal thing. I think the other thing, which I'm curious what your thought about is messaging, is that the invitations to participate in the clinical trials may not get to grassroots people in the Bronx. They may put them out in various aspects of media or social media or whatever, and it doesn't get to the people, ironically, who frankly need it most, because we know where the COVID hit the worst was, of course, our people of color in the Bronx. So maybe you could talk a little bit about messaging and then what might help in the future for these things, because we want to learn something and do it better next time.
Yes, absolutely. So, one of the things that we have started doing is to try to include Spanish-speaking providers and healthcare workers to message those communities that need to understand the benefits of the vaccine. So if your messaging is not in the appropriate language, those communities will not understand the importance of this intervention. So just to give you an example, in the last few weeks, I've been trying to, give that message through, media like this one in their language, and explain in very easy terms why it is important to get the vaccine. So you're absolutely right. People need to get the message correctly. The other thing is that speaking about clinical trials, we have a fairly new clinical trials unit in the Bronx, at Montefiore. So it is important to have these units where things are happening, where we have our communities. It's difficult if people don't have access to these services when facilities are not in their areas. So that's another way to spread the message, to have those clinical trial units in the neighborhood.
Are clinical trials still going on for this, or is in essence we're done because we're getting the vaccines?
So no, so we have two approved vaccines, right? We have the Pfizer vaccine and the Moderna vaccine at this point, but we need to get to 16 billion doses in the world. So the more vaccines we have, the better. We are finishing recruitment on the AstraZeneca vaccine. That's the one, the AstraZeneca Oxford is the vaccine that was recently approved in the United Kingdom. Not yet approved in the United States, but that's the study we started with the AstraZeneca Oxford vaccine, finishing recruitment tomorrow, starting with another vaccine soon.
If anybody wants to participate in the clinical trials, is there an easy way to get in? Do you call the hospital? What do you do?
Correct. I would say the easiest way is it's an email address. It's very easy. It's covidvaccine@montefiore.org. So that would be probably the easiest way to contact us.
Easiest way to do it and say, hey, I want to participate. I want to help my own people, all people. That's the way to do it. Joe Wiederhorn at the Associated Medical Schools of New York. You and I have been on this program together before, and we've talked about disparities. We've dealt with health disparities for years on BronxTalk and BronxNet television. And in a way, that mistrust that both of our other guests said is really at the root of this. Where are we at getting doctors who treat people on a regular basis so that they are treated by somebody who looks like them, in plain language?
Right. And thank you. I'm really pleased to be able to be back again. And this is really important because there have been numerous studies that have shown that if an individual goes to a physician who is of a similar race or ethnicity, they're more likely to follow through with their treatment plans. They're more likely to express completely how they're feeling and what's bothering them, and therefore their treatment outcomes are better. But in terms of how we're doing in New York State, we're not doing that well, frankly. 32% of the people in the state are Black, African-American, or Latinx, and only 12% of the practicing physicians are. So we need to do better. We need a lot of programs that are going to help young people, and young people get discouraged at various parts of the pipeline to get into medical school. And it's difficult. Nobody can say that it's not, but there are lots of programs out there that help students and who are interested in going into medical school. And we need to get that word out as well so that we attract more students to going into medical school.
And I know that you have programs that start as early in high school and getting kids in school. Before the end of the program, let's make sure to put up a contact info, especially for either teachers or parents or even students themselves who say, you know what, always wanted to be a doctor. Now is the time, because of course we need as many as we can possibly get. I want to just reveal to the public for the first time today, I got my the first shot of the COVID vaccine. I got the Moderna vaccine. I was at the Morrisania Health Center, and I brought my little cell phone and we did a little video about it. So you can see what it's like. I did it. I feel fine afterwards, and maybe that reflects what Dr. Collymore said. Frankly, even though some of the reasons to be hesitant is valid, there's no real reason not to do it. So let's take a look. Here's Gary getting the vaccine. Okay, it is vaccine day for me. It's pretty exciting. Nurse Stephanie is here. She knows what she's doing. I don't know what I'm doing, other than I wore a short sleeve shirt so we could do it effortlessly. We thank Stephanie for her great work taking care of the people of the Bronx, which is not an easy task, and we respect everything she's doing. So we're going to go through the process, right? Here we go.
The vaccine.
And this is which vaccine?
This is the Moderna.
Moderna vaccine, lucky me.
Second dose is 4 weeks.
The second dose is?
4 weeks.
4 weeks, all right.
And getting it to you right in the deltoid muscle. And your arm may be a little achy for a day or two.
I did
You may
it.
get a little fatigue, possibly some flu-like symptoms. And if you take some Advil or Tylenol, that'll help you feel better.
Okay. Are there lollipops? Do we do that?
Prior to COVID, we did get lollipops when we would get flu shots. That was always big hit.
But what about people like me who are really big babies?
You want me to draw a smiley face?
On my mask. That'd be great. So this is pretty much it. Oh, she's going to autograph it. Stephanie was here. So now we're doing a show today about it. There are some people who are hesitant. They shouldn't be hesitant, right?
I think it's so important that everybody get vaccinated, because the more people that get vaccinated, we will develop herd immunity, and the benefits far outweigh the risks.
Listen, I'm thrilled to have been able to do it. Now, I'm going to wait now 15 to 20 minutes, make sure everything's okay.
Make sure you're feeling okay, and then you'll be okay. And then in 4 weeks, you'll come back and get another dose. And you have to continue practicing safe social distancing, mask wearing, hand washing, and you won't be fully immunized until 2 weeks after the second dose.
Okay, so it's 4 weeks and then 2 weeks.
Yeah, so
but listen,
6 weeks.
we're all going to stay safe in the Bronx. That's really what this is all about. And I'm going to be socially distant and fair to all the people around me. And that's it. Okay.
That's it.
Thank you so much to the New York City Board of Health, Department of Health, because they're doing it. They're getting it done. I'm here, by the way, at the Morrisania Health Outreach Center. Okay, see you all. Thank you. Well, there you go. I felt fine. I waited 20 minutes. I came out and I felt well. Dr. Collymore, let's just talk about numbers. One thing I discovered today, you talked about 500, was that the facility was not backed up with people, even though probably a lot of people would like to have the vaccine. Is the whole notion of volume simply predicated on the product that you have available, that you just don't have them? And if you had, if you had twice as many available, you could do, instead of 500, you'd have done 1,000.
Yeah, I mean, I would say the vaccine needs to be handled in a unique way. There are some some requirements in terms of storage and management of the vaccine, and in particular with the Moderna, which is the one that we're administering. When you break the seal, when you administer that first dose, you have to administer all 10 doses within a 6-hour period of time. And that's something that we have not had to coordinate with other vaccines. Tetanus, even if you use a multi-dose vial, you can give 2 doses today, you can give 2 doses tomorrow, you can store it. So I think the coordination of individuals to ensure that we do not waste doses adds to the sort of complexity of administration. Absolutely, I think with the expanded criteria now of individuals that we can administer it to, we will go much faster. I think initially we were really confined into that box of healthcare workers and their staff. And then we opened up to congregate care facilities, staff and residents. But now that we can actually give it to a lot of our patients, a significant number of our patients that are 65 and older, I think we're going to start to see the pace at which we're vaccinating start to increase.
I'm curious just about the process, and maybe Dr. Torres can weigh in as well. And so we'll start with you, Dr. Collymore. Does it come off the truck every day and they drop them off, or do you have a storage facility? I mean, the refrigeration is, not the kind of thing you can just keep in the, where you keep your ice cream. You need some serious work on that. What is that process? I think people would be curious to know, how is it that Acacia or Montefiore Medical Center or whomever, the Morrisania Health Center where I went, gets the vaccine, so that it's still vibrant and vital and able to be used.
Right. Well, I know that the Pfizer vaccine, of course, is the one that requires the ultra cold storage temperatures. So primarily hospitals and nursing homes are the ones that are going to be administering and receiving that. On the outpatient side of things, Moderna can be stored in a commercial grade freezer, which
I
is
didn't know that.
we store other vaccines and also. So varicella vaccine is stored in a freezer, and the temperature requirements are similar for long-term storage of Moderna. It's also stable in a refrigerator, and we have medical grade refrigerators. It's stable in a refrigerator for 30 days. It's once it exits the refrigerator that we then have that clock of, this is when we need to start counting the hours before we have to utilize the entire bottle.
Just going back to my original question then, if they dropped off twice as many vaccines, you could administrate the process and do twice as many people. I mean, the president-elect is talking about, doing 1 million a day for 100 days. We're going to need a lot of participants from people like Acacia.
Yeah, no, absolutely. We could store it. We can administer it. We've made ourselves available not only to our existing patients, but to other organizations that have high-risk individuals that fall into the priority group that may not have medical facilities working with them. So we could administer as much volume as we were to receive.
Dr. Torres, I guess let's, since we have a different provider in your case, let's talk about Montefiore Medical Center. I know when I was looking for a vaccine, it was difficult because a lot of providers were like, we don't have them. It took a little while to kind of make it happen. How fluid is, and Montefiore, of course, has many facilities all throughout the Bronx. Are you happy with the way it's being administered from, the companies, or could you see a better system that would get you more vaccines and more people vaccinated?
Yeah, my hope is that things are going to get better and better. First, we're going to have more vaccines, and second, the process is going to improve. So initially, when we had the first line providers getting the vaccine, so we were actually doing the Pfizer vaccine, right? But as David mentioned, the requirements for refrigeration are -70 Celsius. That's more like -90 Fahrenheit. So only hospitals or facilities equipped with these freezers were able to give it. So it made sense for hospitals to give it to their healthcare workers. But now with a vaccine that has less strict requirements, so I hope that soon we're going to start calling our patients for their vaccine. So, as of now, we haven't done a big rollout for patients, but I hope that that's going to happen in the next few weeks. Talking about refrigeration. So I was mentioning the AstraZeneca vaccine. So it is important to know, and this is going to be very important for the world, that this vaccine can be kept in just in a regular refrigerator. So that's going to be very helpful. So I think we're going to see a brighter future in the next few weeks. The initial process, has been a little difficult. I mean, this is the biggest vaccination campaign ever. And then, of course, has its limitations and problems, but I think we're going to get better. Absolutely.
Those of us of a certain age, and I do remember, frankly, sitting with my parents in our car outside of Montefiore Medical Center waiting for the Salk vaccine, for the polio vaccine. And I see Ms. Wiederhorn is, I don't want to typecast her in terms of age, but it was just to let people know, many of us might remember, you got a little plastic or paper cup, and it was a very sweet solution in there, and they gave it to you, and I remember my parents saying, lick out the bottom of it, get it all in. I don't know if maybe one day we'll have an oral vaccine as well for COVID. I don't know. Joe Wiederhorn, you recall? Are you willing to admit?
I do recall, yes.
So let's just go around the room now. Ms. Wiederhorn, for people, is there anything else you wanted to mention in relation to this? I mean, to me, your part is like the foundation of this. We really have got to get these health disparities in medical care dealt with. So we want the information for people who want to access programs for kids or parents or whomever want to get to medical school. Let's do that.
Okay, sure. If I could just say one thing, though, and this is something else that my organization does. We also need a diverse work group of researchers, people who, like Dr. Torres, who are at the bench, really trying to look at different diseases that come and whose interests are in other areas maybe than what you would normally think of some white male researcher looking into. And a good example is really when you look at Henrietta Lacks.
Because we're going to run out of time. So.
Oh, sorry. Okay, so you can forget all of that part. Our number.
What's the contact info to get all this stuff? What do? They email you, email the program, what?
They can email info@amsny.org.
That sounds great. Dr. Collymore, the bottom line, please reach out to Acacia, reach out to whomever and get vaccinated. That's the message, right?
Absolutely. Get vaccinated. If you have questions, find a healthcare provider like myself or like Julian. We will answer your questions. And we are encouraging our community, our family, to get vaccinated.
Right. We, and the bottom line was we understand the concern, but right now, let's get past that and see if we can't get everybody vaccinated.
Absolutely.
So thank Dr. David Collymore from Acacia Network, Dr. Julian Torres from Montefiore Medical Center, and Joe Wiederhorn from the Associated Medical Schools of New York. Thank you so much. We're trying to get people healthy, get vaccinated, stay safe, wear your mask, et cetera, et cetera. Next week, we'll check in with the state legislature and find out what they're up to in their brand new session. There's so much going on. You know that. We'll be with you on BronxTalk every week.